Hi everyone, just wanted to go over a few items from last week and this week. I've now recorded this. This is the third time, so so I'll try and keep it brief this time. Maybe I'm talking too much. So this past week, week 5, we talked about clinical trials, community-based participatory research, and quantitative methods in general. So typically, clinical trials will be quantitative in nature. Sometimes they'll be mixed methods. So a mixed methods study, when you think, I don't think we really talk about mixed methods in here, it might be mentioned in the book, but a mixed methods study is when you have a mix of quantitative and qualitative research. So think about your CSS surveys that you do at the end of each class. There's quantitative because all those Likert scale questions that you answer, rated on a 1 to 5, with 1 being the lowest, 5 being the highest. That's quantitative in nature because it's numbers, statistical analysis. But then we also ask you for comments. So the comments that you list will provide us with some qualitative information. So those are mixed methods types, surveys, mixed methods research. But so typically a clinical trial is going to be mainly quantitative in nature. They'll look at rates of effectiveness, rates of adverse effects, those types of things. So lots of info in the classroom on those two types of research, both clinical trials and the community-based, and then also the overview of quantitative. So this week we're going to look at data analysis. So what happens when you do all of that quantitative research? Well, you're going to have thousands and thousands of data points. You need to figure out what they mean. And sometimes you can take a look at data and get an idea. But generally, you need to be able to apply statistical tests. So things like t-tests or linear regression or regression analysis and all of these different types of things that you'll do with the data to get an idea of what the numbers mean and whether something is significant or not. Sometimes you'll look at data and just glancing at it, and you may be like, wow, that's a major research finding. But then when you start applying statistical tests, you're like, oh, well, it's not really significant because of the fact that maybe it was the thing that you're seeing was an outlier on one side or the other or something like that. So in the classroom this week, we do have this intro to stats. I would suggest taking a look at it if, number one, you took stats a long time ago and you don't remember it, or if stats are something that you're not really familiar with. I think everyone in this class probably has taken statistics. I think it was a prereq for everyone. But if not, take a look at that and it might provide you with some stats, not just like stats math-wise, which I think is what the statistics class is that we have, but how it applies to research in the social sciences. Then we have some data analytics information in here as well. Also, I think most of you took my data analytics class, so you're probably familiar with most of those areas. But our discussion this week is about this article here, data analysts and how they can provide their full value. We have a blog this week, and then we have our quiz, and then obviously this Edpuzzle. So sorry. So let's go over a couple of the quiz questions. Everyone did really well on the quiz. Keep in mind, I think I've mentioned this before, keep in mind that you may not have received these questions. They're based on a pool, so not everyone gets the same questions. But there were a few that were missed, but generally everyone did really well on the quiz. So first question, what is the paradigm associated with community-based participatory research? So in the textbook, it talks about research paradigms. And when you do research, primary research, you're always going to have a theory that kind of backs up why you're thinking what you're thinking about your research. So for example, when I did my dissertation research, I was looking at barriers to implementation of workplace wellness programs, and change theory was the theory. A few different change theories, but in general, change theory was the theoretical background to my study. My notion was that people didn't implement these programs because they were fearful of change. And they didn't have the requisite parts in place in their organization to make change effectively. So, and that was proven through my research. So you're typically going to have some theoretical basis for your research. In association with that, and what kind of drives oftentimes your theory is this notion of a paradigm. So you might have like positivism is a research paradigm where there's a single reality. Everything is the same for everyone for this particular topic. So, if you Oh, I can't even think. If you eat a cake every day, you're probably going to gain weight. That's a positive. That's a research paradigm. If you research that, it doesn't matter where you live. It doesn't matter, who you are, what background you're from, how much money you make. You're likely to gain weight if you eat a whole cake every day. But when we're talking about community-based participatory research, the paradigm associated is constructivism. So think about, I think I mentioned this last week when I talked about this type of research. So let's say I want to do research on runners. And so I'm a member of a couple of running groups, Marathon Maniacs and the Half Fanatics, and they're worldwide groups. So we have people all across the world, and all different types of people. So different fitness levels, different socioeconomic status, obviously different geographic areas. So the reality of running for people in all those different areas with all those different attributes is not the same. There are multiple realities. So me going out to run versus somebody that lives in maybe Saudi Arabia going out to run versus somebody that lives in Russia going out to run, and all different, again, fitness levels, gender, age, etc., could all be very different. So there's different realities, and what this constructivist paradigm states is that there are different realities, and we should study them, and we should dig into them and understand them. So when we do our research, we need to not only say, okay, how long do you run? How long does it take you? How do you feel? Blah, blah, blah. But we also want to know things like, what is your geographic location? What is your fitness level? How old are you? What is your gender? What is your socioeconomic status? All of that kind of stuff can also be important to the research because the reality can be different based on some of those things. As opposed to person eats a whole cake every day, they're probably going to gain weight. All of those things are not likely to matter in the long run. I think there was that show, I don't remember what it was called, Super Size Me, the gentleman that ate McDonald's every day for every meal for a month, and how he gained weight and he got sick. I mean, that's likely to happen to anybody that does that. So that's a single reality versus when you're looking at a community, especially a broad community, you're likely to have multiple realities. So hopefully that makes sense. Sometimes the theoretical stuff is difficult to grasp, and I 100% understand that. I have not so fond memories of my doctoral program and trying to understand some of these theories and how they apply. But sometimes if you break it down and look at some examples, it can be easier. Next question. So when should the research site report serious adverse events to the study sponsor or institutional review board? So you're going to want to do that within 24 hours. Sometimes the IRB or even the study sponsor is required to then turn that data over to the government. It could be the NIH, OHRP, different organizations, but depends on the situation, the study, the funding, all of that stuff. But generally, research sites need to report those serious adverse events within 24 hours to the IRB or the study sponsor. Once a study medication or device is approved, the FDA does not require continued data collection. Now, obviously, this is a true or false question. Our answer is false. So think about a study or think about a drug that perhaps you've seen that has been recalled, or you see the ads. I see the ads all the time. I'm a bit of an insomniac, so I watch a lot of really late night TV, and I'll see ads on there for, if you've taken this drug, call this law firm and we'll help you to get money back for the, whatever happened to you. So oftentimes the way that we find out about those situations is that it was a long-term study. So once the FDA approves a medication or a device for marketing, although they don't really get too involved in device stuff that much. I mean, the FDA looks at devices, but it's really more about investigational new drugs. once something has been approved for marketing, long-term studies continue. So they'll start to look at patients on the drug for 1 year, 2 years, 5 years, 10 years. That study continues indefinitely if it's a long-term drug, like something that you would take for a chronic illness. And so that was the data collection continues, and that's when sometimes we see, like for example, I actually have the I took a drug for blood pressure, Benacar. I took for blood pressure, high blood pressure, and come to find out it created what they called a celiac-like enteropathy for me. So it created a situation that mimicked, or was very similar to celiac disease. So celiac disease is the disease that where you can't eat anything with gluten in it. So at first, when I had yeah, I actually had genetic tests and genetic markers that showed that I could very well have celiac disease. I finally had some biopsies done, and they said, no, you don't actually have celiac, although you're prone to it. But we think it's this medication, because they were seeing that in long-term studies, that this Benacar medication was causing what they call the celiac-like enteropathy. So the same, and we'll use our medical terminology. Our medical terminology learning. So entero is intestines, and pathy or patho is disease. So it's just a a disease of the intestines, or an issue with your intestines caused by this drug that mimics celiac disease. They said it would probably go away in a year or two, and I still have issues with it. So I often see those ads on television about the medications, and I have seen them for Benacar, but I am not a litigious sort, so I will not be suing the company. But so it's these long-term studies that really give us the long-term outlook of people taking these medications. People take medications for years and years and years. I've been taking, with the exception of a short break here when I couldn't get it, but Plaquenil, which is the drug, hydrochloroquine, the drug that for a while the president was telling everyone to take because it would cure COVID. I take that for lupus, and I've been taking it for 23 years. Although there was a short period of time where I couldn't get it because everyone was stockpiling it because they thought it was good for COVID, when in fact it actually isn't. So thank goodness that happened. I was able to start taking that medication again. But so that's a medication that generally in the general population can be quite dangerous. But for me, I have blood tests every 6 months. I have to have visual field exams every 6 months to make sure that I'm not having issues, and I obviously tolerate it without issue. But so important to know that these long-term studies of drugs are very important to keeping the population here in the U.S. safe, because obviously these only apply to U.S. Medications dispensed in the U.S. Okay, so that's all I've got. If you have any questions about our work for this week, please just feel free to reach out. It's probably kind of more of a review outside of the statistical piece, probably more of a review for everyone that's already taken the data analytics course, but make sure that you dig in a little bit on the stats side and understand how the statistical tests work for quantitative research. So that's all I've got. I will talk to everyone or see everyone in the classroom. Thanks.